So melanoma is a type of cancer found on the skin that's caused by mutations within the DNA, which can be caused from ultraviolet radiation and sun exposure. So your chances of getting melanoma double every time you've had 5 sunburns, and also one person dies from melanoma every hour, which kind of shows that it's a very common type of cancer. There are a lot of biopsies that help test whether or not you have melanoma, and that's kind of where my research stemmed. So my thesis kind of explored the different logistics that came with melanoma biopsies. So who's performing the biopsies, who's looking at the specimens, the how it's being photographed, the picture of the melanoma, and also the different biopsies themselves. And you know, a lot of the biopsies are effective, and a lot of the articles did agree with each other. So I kind of explored the different articles and the different types of biopsies and the pros and cons of them. So for diagnosis logistics, so I found it interesting that a lot of articles actually kind of looked at who's the pathologists themselves, and they concluded that pathologists with over 5 years of experience are better when performing these biopsy tests and actually diagnosing. They usually are more accurate. And I also found it interesting that they did experiments with the different technology devices used for taking photographs, and they concluded that it's really cost effective to use the patient's personal digital device, so their mobile phone, to take pictures of the surgical site identification instead of using the professional technology that costs a lot of money. So I also found that really interesting. For warning signs, I researched other articles as well, and they found that itching and bleeding are some leading causing signs of melanoma, and that's when a patient should go to a dermatologist and have kind of their skin looked at. If any mole is growing or changing shape and color and size, those are, you know, signs that they might have melanoma, and they should get a biopsy for it. Yeah, and then also I found it interesting that the iris pattern, having freckles in your eye, can also lead to having melanoma or be a warning sign for that. And also having Parkinson's disease is another leading kind of contributor to having melanoma, and there's a lot of correlation between them. So for biopsy diagnosis, lymphatic mapping, which is taking dyes and radioactive dyes and looking at kind of the lymph nodes, which stretch. Your lymphatic system stretches throughout your body, and the lymph nodes are the actual tumors within them, and kind of looking at which ones have cancerous cells. And this is argued to be done before the sentinel lymph node biopsy, which actually takes out the lymph nodes. And there's kind of some controversy between whether or not this is a good biopsy diagnosis for melanoma, but most of them do agree with the sentinel lymph node biopsy, but some say that there should be other biopsies taken before it. And then there's blood biopsies, and also taking the tissues from the skin and looking at that, having a pathologist look at those. Those are also great biopsies that I found. And this is the ultrasound guided biopsy, and this also, a lot of research articles agreed that this was a good biopsy. So in conclusion, a lot of these biopsies are effective, and a lot of the research articles concluded that they're effective. There was some controversy in the sentinel lymph node biopsy, however, but I think overall a lot of them used a variety of different patients with different stages of melanoma and looked at kind of the different biopsies. There were very few false negatives within the different biopsies, and that's kind of my take on the research I've done. I think further we should look at the pros and cons of each of the biopsies and kind of compare and contrast them instead of looking at all of them separately.